Hello guys, welcome to my new video about another shocking disease. Fibrodysplasia ossificans progressiva (FOP) is a genetic condition where people are born with bunions and their body's muscle tissue and connective tissues like tendons and ligaments turn into bone on the outside of their skeleton. This condition restricts movement and can cause a loss of mobility over time in people diagnosed with the condition. Symptoms of FOP appear during childhood and usually begin at the neck and shoulders before moving to other areas of the body. It can affect anyone because it's most often the result of a new genetic mutation that wasn't inherited from a parent. Fibrodysplasia ossificans progressiva is a very rare condition that occurs in an estimated 1 out of every 2 million people worldwide. People diagnosed with fibrodysplasia ossificans progressiva have a restricted range of motion due to their muscles and connective tissue gradually turning into bone. Any type of trauma to the body can cause a flare-up of the condition. This could be after surgery, a fall, or an illness like the flu. These trigger swelling and inflammation of the muscles that last for days to months around the affected area. Children may experience difficulty eating, malnutrition, and speaking because irregular bone growth causes the mouth to not open completely. Extra bone growth around the rib cage can restrict how lungs expand and cause breathing difficulties. A mutation of the ACVR1 gene causes fibrodysplasia ossificans progressiva, known as the Stone Man syndrome. The ACVR1 gene gives your body instructions to make type 1 receptors for a protein called bone morphogenic protein, BMP, that reside in your muscles and cartilage. BMP controls how bones and muscles grow and develop. The mutation of ACVR1 causes symptoms of fibrodysplasia ossificans progressiva because the receptor, like a light switch, is always on when it should turn off. Fibrodysplasia ossificans progressiva, or the Stone Man syndrome, is an autosomal dominant condition, which means only one biological parent needs to pass the altered gene to the child for them to inherit it. If a parent has the gene that causes this disease, there is a 50% chance that the child will inherit the condition. Most cases of fibrodysplasia ossificans progressiva occur because of a new mutation of the ACVR1 gene. This happens randomly and there is no link to the gene being present in a person's family history. The main symptom of FOP is the gradual replacement of muscles, tendons, and ligaments into bone. This process begins at the neck and shoulders in early childhood and progresses throughout the body over time. The development of bone can be rapid in some cases or very slow in others. Each case is unique. Symptoms arise during flare-ups, which are your body's reaction to trauma that could be from an injury, surgery, or viral illness like the flu. Swelling or an increase in size or shape of a part of the body can be painful. When flare-ups occur, the bone morphogenic protein type 1 receptors fail to stop producing proteins, which causes new bone to form on muscles, tendons, and ligaments. After new bone forms, swelling decreases, which could take anywhere from a few days to a month. A symptom of the condition that leads to an FOP diagnosis is a malformed and short big toe that sometimes grows inward and over the second toe. Growth differences of the big toes are visible at birth, even before other symptoms appear. Nearly 50% of cases of FOP also have malformations of the thumbs similar to the big toe. Diagnosis of FOP begins with a physical examination that identifies the symptoms of the condition, along with reviewing your medical history and performing a genetic test, which is a blood test to identify the gene mutation that causes symptoms. Imaging tests like an X-ray help your healthcare provider examine new bone growth over muscle and connective tissue. Diagnosis of fibrodysplasia ossificans progressiva can be challenging for healthcare providers. This occurs because FOP is extremely rare and very few healthcare providers encounter it during their careers.
FOP is a rare bone disease that affects 1 in 2 million people, and it causes my muscles and connective tissues to turn to bone, which gradually forms a second skeleton.
A biopsy of an FOP tumor, when your healthcare provider removes a small portion of the tumor to examine the cells under a microscope, often looks similar to a cancerous tumor. If your healthcare provider suspects an FOP diagnosis, they won't perform a diagnostic biopsy because the procedure can cause severe bone growth flare-ups. The most important symptoms that lead to an FOP diagnosis are malformed big toes and soft tissue swelling that forms throughout the body.
Ashley Kerpio lives outside Atlanta, Georgia. As a toddler, her arm was amputated after doctors misdiagnosed her with cancer. They missed the telltale signature of FOP disease, a crooked big toe. Now her muscles have started hardening into bone. Nancy Sando is one of the oldest living people with FOP. She inches her way toward the bed. Her body is stiff as a board.
God has given me the ability to find the joys in the little things in life.
It's a tremendous hardship.
Treatment for fibrodysplasia ossificans progressiva aims to reduce symptoms, especially flare-ups that ignite the bone-growing process. There is no cure for FOP, but research and clinical trials are progressing to help people diagnosed with the condition. Treatment is unique for each person to address their specific symptoms. Treatment for FOP could include getting genetic counseling for social, emotional, and health-related support, participating in occupational therapy to improve physical needs, preventative antibiotic therapy to avoid respiratory infections, taking medication to reduce swelling and pain associated with flare-ups, using mobility equipment like a wheelchair, and wearing a brace. Fibrodysplasia ossificans progressiva is a lifelong condition with no cure. The prognosis or outlook is poor due to severe symptoms of the condition, including respiratory infections and restricted mobility that becomes worse over time. Life expectancy for someone diagnosed with this problem is reduced into early adulthood. Most people are completely immobile by age 30. The most common cause of death among people with an FOP diagnosis is a respiratory infection. Research and clinical trials for new treatment options are in progress to help reduce symptoms and prolong the life of people diagnosed with the condition. After receiving a rare genetic diagnosis, you may be asking yourself, what do I do next? Your healthcare provider will monitor your health regularly and offer additional support. They may recommend you see a genetic counselor or an occupational therapist to help you better understand your diagnosis, minimize flare-ups, and ultimately lead a comfortable life. Clinical trials and research are progressing to offer additional support to people diagnosed with this condition.